Pfizer is seeking emergency approval for that shot meant to help protect Americans from COVID-19. The pharmaceutical company says it's working on its version of a vaccine to maintain efficacy against emerging mutated strains of the coronavirus, like, of course, the highly contagious Delta variant. It's now the dominant strain in 5 under-vaccinated states, including Missouri, where it makes up more than 70% of new cases. But in a joint statement, the CDC and the FDA say Americans who have been fully vaccinated, quote, do not need a booster shot at this time. So let's get more clarity on this from Dr. Bob Lahita. He's the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Bob, so Pfizer developing this booster shot. It's meant to target the Delta variant, but the CDC and the FDA say that, for example, Anne-Marie and I, who have the Pfizer, who've been vaccinated with the Pfizer vaccine, do not need a booster shot right now. Walk us through the agency's reasoning. Do you agree? And when might those of us who are vaccinated need a booster shot?
I agree, Vlad. And here's the thing, we've only followed patients that were from the phase 3 trials. Those are the ones that got the vaccine before all the rest of us did. We're following them out, and so far, at about 8 to 10 months, they are fully protected. So the good news is that it doesn't look like we're going to need a booster shot perhaps this year, but maybe next year, or maybe the year after. But Pfizer's taking no chances, particularly since the Delta variant is wreaking havoc in parts of the South and the Southwest.
So then what is the threshold as to when a booster shot could be necessary?
Well, a booster shot will be necessary when we start to see the neutralizing antibody in a large number of people decline. Now, most of us have said that cellular immunity, which is very difficult to measure, and it really involves your T lymphocytes in your blood. These are really potent antiviral cells that are around. And so far, it looks like these antiviral cells are present in all of us that have been vaccinated. So to make it necessary to get a booster would probably be moot at this time. However, there are people out there, have immunodeficiencies, are on cancer medicines, etc. They may need a booster shot because their immune systems are not up to par like most of the population is.
So, Dr. Bob, many people reported feeling side effects from the vaccines. Is the same expected to happen with a booster?
It would happen with the booster in some people. The numbers that I look at, we see patients going from no side effects to patients that develop rashes, headaches, a fever for maybe a day or so, or maybe soreness at the site of the injection. That's probably what you're going to see. My hunch is there's going to be very little side effects with any booster shot going forward, especially with the mRNA vaccine, which is the Pfizer and Moderna.
So a new study says that the U.S. COVID-19 vaccination campaign has prevented up to 279,000 deaths and over 1 million hospitalizations. Good news. However, it warns that unvaccinated Americans could trigger a new wave of deaths and hospitalizations. In fact, I think yesterday the COVID task force talked about a little bit of an uptick in sort of all of those metrics. Can you walk us through what it takes for a virus to mutate, and could we see another strain mutate from the Delta variant? I know there's another one, Lambda, now I'm going to mispronounce it, Lambda. Another mutation that's coming out of Peru. So, could we see more?
Yes, but Anne-Marie, Vlad, what I said maybe 8 months ago is that viruses like to mutate. They mutate up, making them far worse as far as infectivity goes and the kind of side effects you have, and they down mutate. Some of them just mutate themselves out of existence, which we don't see because we don't look for that. But what we do notice is the viruses that mutate up. And we are constantly seeing this very fragile molecule of RNA, which is in the coronavirus, adjusting itself. As I mentioned one time, you have to consider like a paragraph on a word processor. You change a few words, that's a mutation. If you can't read the paragraph that you originally typed, that's a mutation that changes the whole character of the virus. So then that virus has spike proteins and things that your immune system doesn't recognize all of a sudden. It's saying, wow, I've got to retool myself. I've got to get new cells in here. I've got to make new antibody. That's what a mutation is. The mutation is a change in the proteins that are produced by the RNA of the virus, and specifically the coronavirus. So it makes a lot of sense that we may need new vaccines, and we actually may need new monoclonal antibodies to control the acute infection that we see, for example, in the emergency room, to keep people out of the ICU.
So, Dr. Bob, one last question on this. What might a significant surge in the Delta variant or another variant look like in the United States from a public health policy perspective? In other words, those of us who are protected, who are vaccinated, clearly you're not going to ask people, public health officials, governors, are not going to ask people to lock themselves down again if the risk of being hospitalized or being very sick is remote. But what about our neighbors and our family members and friends that we have in other states who are not? In other words, there will be people rubbing shoulders with people who are vaccinated and people who aren't vaccinated. What do you do in that situation?
Well, the CDC and the NIAID is recommending that if you have any reserves in your brain, do wear a mask and social distance. If you're around somebody who's coughing and sneezing and they say, gee, I have bad allergies, and that's what this is all about. Well, you don't know that. So it's best to be careful, wash your hands, wear a mask, and keep a safe distance from somebody who's sneezing and coughing, because you simply don't know. This Delta variant affects people in different ways. Obviously, just like the original Alpha variant did. The COVID variant, the Delta variant, may cause severe illness, and in young people, it may cause practically nothing. You may just walk around thinking you have a cold or you have an allergy. So that's the important thing. Be careful is my admonition to everybody.
It's a good one. Dr. Bob Lahita, thank you very much as always. Have a nice weekend.
Thank you.